Hello, we can hear you. Thank you.
Thank you. So for those who've just joined us, my name is Tia Sira. I'm with the Pacific Island Forum Secretariat. I'm currently the focal point for the Pacific Resilience Partnership. And it is my pleasure to introduce your speakers today for Theme 5. His Excellency John Feeks is the Australian High Commissioner to Fiji. His Excellency John Feeks is a senior career officer with the Department of Foreign Affairs and Trade, and he will be providing a state of play in the context of the theme that we are discussing today. This will then be followed by 3 panelists who will respond by sharing what they are doing and their commitments to improve the state of play. And your panelists for today include Reverend James Bhagwan, the Secretary General of the Pacific Conference of Churches, the peak ecumenical body in the region with 33 member churches and 10 National Council of Churches across 18 Pacific Island states and territories. We have also joining us from Solomon Island, Mr. Casper Vasala, who is the Office Manager for Disability Solomon Islands. And with me here in the room is Ms. Sabira Coelho, who currently serves as the Program Manager at IOM Fiji for the Joint Agency Regional Program on Pacific Climate Change, Migration, and Human Security, usually known by its acronym as PCCMHS. So just for a few housekeeping matters before we start, please mute your mic at all times unless you are presenting. And there will be a Q&A session after all presenters have had an opportunity to present. And for those joining us online, please raise your questions through the chat function. And for those of us who are here in person, raise your hands and a microphone will be presented to you. Without further ado, I now hand over the floor to His Excellency John Feeks. Thank you.
Thank you, Tia, for the introduction. I'd like as well to extend my appreciation to the other panelists today, Casper, Sabira, and the Reverend James. I'm honoured to be here today to participate in this important meeting on disability in the Pacific, and specifically this session in the context of climate change and disasters. As you all know, our region is on the front line of climate change and disasters, as we're acknowledged in the Pacific Islands Forum Boy and Kainaki II declarations. Past experiences have taught us that the consequences of climate change and disasters are often more severe for people with disabilities than the general population. Many are at risk of neglect, abandonment, and even death during instances of migration or natural disasters due to physical, communication, and other barriers, as well as disrupted support networks. Research conducted in Vanuatu after Tropical Cyclone Pam found that 60% of people with disabilities reported a lack of emergency and preparedness information. The injury rate among people with disabilities was almost 2.5 times higher than those without disabilities. And when we overlay other forms of identity, like gender and age, the statistics are even more concerning. 74% of women with disabilities reported barriers to accessing evacuation centres, compared to just 50% of men with disabilities. And during humanitarian crises, children with disabilities are at higher risk of abuse and neglect, and women with disabilities are at higher risk of sexual violence. People with disabilities are at times in situations of social, economic, and political disadvantage and can have less access to services and support. This is why governments, development partners, and organisations of persons with disabilities must work together to ensure people with disability are actively included at global, regional, and national levels. At the global level, Australia has worked hard to ensure people with disabilities are included in programming and disaster preparedness. COP26 was historic for people with disabilities, as it was the first time that organisations of persons with disabilities could acquire observer status and had official delegations at COP. Australia was pleased to join the Global Action on Disability Network Climate Change and Disability Working Group for COP26. In July 2019, we co-sponsored the first UN Human Rights Council resolution on climate change and the rights of people with disabilities, which called on governments to adopt a disability inclusive approach. At the regional level, Australia supports long-time partners like the Pacific Disability Forum and the Pacific Resilience Partnership, and we take part in various frameworks and declarations. The Framework for Resilient Development in the Pacific stipulates that all national climate change adaptation strategies, disaster risk management plans, and legal frameworks must specifically address the needs of people with disabilities. The Pacific Framework on the Rights of Persons with Disabilities sets out how the rights of people with disabilities can be realised across the region, and it contains a goal on disaster risk management, which has been endorsed by all Pacific governments. As a Pacific Islands Forum member, Australia has been proud to join regional declarations such as the Boy Declaration. The Boy Declaration reaffirms that climate change remains the single greatest threat to the livelihood, security and well-being of the peoples of the Pacific, and can be further elaborated to include gender, disability and social inclusion, as could other regional declarations such as Kainaki 2. And as host of the upcoming Asia-Pacific Ministerial Conference of Disaster Risk Reduction in Brisbane in September this year, Australia is committed to working with partners, including the UN Office for Disaster Risk Reduction, to ensure that there is a strong focus on disability inclusion. Ladies and gentlemen, at the national level, the collection of obligations, partnerships and agreements made at the international levels must translate into national plans and local government activities. Yet, people with disabilities are often left out of community disaster management, risk reduction and climate action. Australia is a proud disability inclusive donor and steadfast partner in climate change and disaster resilience. Disability inclusion is a key thematic priority of DFAT's COVID-19 Partnership for Recovery Policy and Climate Change Action Strategy for the years 2020 to 2025. We integrate climate change and disaster resilience into every sector of Australia's $1.4 billion annual Pacific Development Program, and we prioritise gender, disability and social inclusion within this. The Australian Humanitarian Partnership's $50 million Disaster Ready program, for example, embeds participation and inclusion of people with disabilities. This program includes specific indicators and disaggregated data to track progress. We also ensure our infrastructure investments are accessible and strong enough to withstand disasters, so that they are better able to serve the whole community in the aftermath of a disaster. There are many examples of our investments across the region, such as markets at Raki Raki in Fiji and Gizo in the Solomon Islands, and education and health infrastructure in Tuvalu, Kiribati, Vanuatu, and elsewhere in Fiji, to mention just a few. Our Climate and Ocean Support Program in the Pacific works with the National Meteorological Services to produce seasonal rainfall forecasts. These forecasts are produced in consultation with national disability organisations and women's organisations to ensure that rainfall and climate information is more readily accessible. These examples illustrate, I hope, how Australia is committed to ensuring our action on climate change respects, promotes, and considers the rights of people with disabilities. In conclusion, people with disabilities and their representative organisations must be meaningfully involved in making decisions that impact their lives, including, importantly, in crisis preparedness and response. Their knowledge, their experiences are essential to the survival and resilience of our communities. The key principle of nothing about us without us is absolutely critical. There are a lot of challenges, but there are also a lot of opportunities to progress this agenda together. Australia will continue to work with you all, being a strong advocate for people with disabilities and for the region. Thank you again for having me, and God bless you all.
Tia, your microphone was off. We didn't hear what you said, unfortunately.
I think you're muted, or your microphone is turned off. It's not working anyway. Tia?
Unfortunately, you're still muted, Tia. We can't hear you.
Happy to go ahead if that's what you would like. Okay, I take that nod as a yes. Okay, and the thumbs up. All right, very good. Mulavinak, everyone, and warm Pacific greetings to you all. And I thank my friend, Ambassador or High Commissioner John Feeks for his state of play, sharing with us the situation, the standards, and where we should be. And I guess in the next few speakers, we will start to really examine where we are. Let me begin while John is still with us, acknowledge the Australian government's partnership with the Pacific Conference of Churches through the Pacific Church Partnership Program. And in our development of the Pacific Church Partnership Program Advisory Network, we have ensured that we have a representative from the Pacific Pacific Disability Forum in that advisory network, continuing the commitment around nothing about us without us. And so I think that's one of the things I just wanted to highlight as we go into this, this sharing. The Pacific Conference of Churches works very closely with the Pacific Disability Forum through our engagement under the Pringo Alliance, which is the Pacific Regional NGO Alliance. And so we have regular engagements, and we're able to listen to each other and share and talk about the work and the issues that we are facing. While we've heard in the state of play, the declarations that have been made by our Pacific leaders through the Pacific Islands Forum and the opportunities that they provide, we've also heard from John the fact that some of these things do not reach down to the community level, particularly in times of crisis and conflict. And this is where we need to, as the faith communities, recognize and continue to advocate in partnership with our sisters and brothers, people with disabilities, some of the key concerns, particularly around ensuring the issues of evacuation, response being specifically targeted for people with disabilities so that no one is left behind, in the increasing cases of extreme weather patterns that we experience as a result of climate change. And in the rebuilding, the getting things back on track, often this is the challenge that we face, because when homes are rebuilt, when places are rebuilt, the opportunity to engage in ensuring that these buildings are disability friendly is often not taken into account. And so this is something that we think is quite important for us to keep in mind. During the last 2 years of COVID across many parts of our region, and I recognize also that some of our Pacific Island countries are experiencing COVID-19 for the first time this year. And so maybe lessons over the last 2 years can be learned and course corrections can be made in some of the responses. We continue to hear about the access or the lack of access to services from people or by people with disabilities, particularly during times of lockdowns. Access to government services that are offered to the general public are not made or do not take into account our sisters and brothers with disabilities, including when there is access to funds being made available. In the context of conflict, this is exacerbated, particularly on the issue of safety and evacuation of people during times of political violence or other forms of crisis. And on a broader regional scale, within the growing issues around the geopolitical, particularly the Indo-Pacific strategy and the challenges that we see in that between the Quad countries and China. Most recently, the visit of the US Secretary of State to the Pacific and particularly to Fiji, we noted that there was no inclusion of people with disabilities, either in the civil society's conversation or in the government conversation. In the context of the climate crisis, and we've heard again from the state of play, the issues around evacuation, around relocation. This for us at PCC is one of the key areas that we have noted in our decade-long work on the impact of climate change and climate-induced migration. The lack of inclusive planning for people with disabilities, particularly around where the communities are relocated. Because most of the communities are being relocated as a result of rising sea level, moving inland also means often moving uphill, which for people with physical disabilities is a key issue of access to their homes or from their homes to other parts of the community, to the seashore if they need to go and join in fishing drives, to their plantation if they want to meaningfully engage. And so that challenge continues to be something that we see in the few relocation programs that have been undertaken so far, but can be addressed as we move forward. The other continuing issue for us, of course, as a result of COVID and climate-induced relocation are the psychological impacts, the psychosocial trauma that people have experienced. So moving away from the issue of physical disability to the issues around psychosocial health, and both within the context of relocations, the issues that people face when they're uprooted from their place of what is home to them, what is their identity, and again, the issue of being locked down and how that affects mental health. So these are some of the things that we have been reflecting on. We continue to engage with our colleagues at the Pacific Disability Forum. Recently, we engaged in a conversation around ensuring the voice of young people with disabilities being heard in our church spaces. And so that has been considered, and spaces being made within our regional ecumenical youth council, so that representative from the community of young people with disabilities present as well. I'm mindful of time, so I will leave it there, and I look forward to the discussions after the other presentations. Vinaka.
Hello.
Jasper, I think while they reconnect, you are on.
Yes, hi, I believe while we wait. Oh, is this them?
Hi, can you hear us now?
We can hear you. There's quite an echo, but we can hear you.
Thank you, Reverend James, and now invite Casper. Thank you.
Casper, I believe it is over to you.
Thank you. Thank you. Thank you so much. Good afternoon, everyone. First of all, let me thank the Australian High Commission for his comprehensive presentation this afternoon, and many of the discussions I concur with Reverend James in his discussions earlier. Solomon Islands, as we all know, is prone to hazards, cyclones, earthquakes, key tides, and floods. Sea rise is now critical, and more so in terms of crisis, as the Pacific would know. Solomon Islands is also known for its man-made conflicts and crises. This is very serious, and it's something that many disabilities suffers from the effects of those man-made crises has recently been experienced, and so it endangers their lives, destroy homes, as well as in terms of additional crisis on climate change, destroy crops, soils, and a big challenge for Solomon Islands is that a couple of islands are now sinking. The unfortunate thing for Solomon Islands is that people with disabilities are not fully mandated to be part of the resolutions in terms of managing conflicts and part of managing crisis. But sadly enough to note here, for Solomon Islands, I think there is no policies, no legislations as to measure and to be able to manage conflicts as and when they arise. For this reason, it then, of course, makes it worse on the issue of caring for disabilities, and therefore situation for Solomon Islands. However, in terms of climate change, for that purpose, Solomon Islands has been part of a study that has been carried out, supported by PDF, and that has been completed. And we hope that the PDF and the Australian government will support releasing of the report of the findings to help us move forward, especially in terms of taking actions of the recommendations. Solomon Islands also is yet among others, but probably we are the least yes at this stage to ratify the convention, the CRPD, and which is paramount to us. And without that, there is no commitment of the state in terms of addressing some of the issues that are affecting persons with disabilities. We welcome the support that has been given to Solomon Islands, more especially to the international NGOs here, that through that we have made possible partnership with the programs, and therefore have some support coming in to support disabilities. And I'm using examples here as the reality in terms of the route that happened last year in November. We were able to support our persons with disabilities in Honiara by supplying basic food and, of course, some of the hygienic items. For this corona, we are again aligning our work with the international NGOs here to support our disabilities, basically in Honiara, only to deliver them with the basic needs at home, and hopefully that will support and complement their needs at this crucial time when they're faced with corona in Honiara, basically. Our challenge here is how do we reach the people and the disabilities within the rural sector. The linkage that is expected for the feedback to the people with disabilities from the government is lacking at the moment. In terms of the focal point, national focal point, which is the government Ministry of Health, we are unable to be supported from that department, and therefore we are not being able to reach out to the needs of patients with disabilities in the provinces. Allow me to acknowledge again the presentation made by the Australian High Commission in relation to inclusion. And I think Solomon Islands now would need support in looking at issues on climate change, but more so in terms of evacuation centers, and more so in terms of shelter, because some of our disabilities live along the coastal areas and the sea is eating up their homes right now in Honiara as we speak. We understand that Solomon Islands being supported in terms of monetary support for infrastructure in Solomon Islands, that we hope that some of those support and commitment be given to disabilities in looking at building an evacuation center for disabilities, which can be also used by the communities as and when disasters strike the country. But more so also we would be interested in the support of shelter for independent living for some of our disabilities, more especially those who are living in Honiara. All in all, this is what I can say at the moment in terms of the agenda, and thank you so much for listening.
Tia, do we still have you connected?
Hello?
Okay, so we cannot hear you, but I believe it's okay for the next speaker to come, and that is Sabira.
You hear us online?
Yes, there's a very intense echo.
I think we're just trying to resolve it. Hola, colleagues. Can I just check if you can hear me?
We can hear you, but there is an echo.
All right, thank you. Perhaps you can just try to proceed in the interest of time. So thank you to Tia, and good afternoon, Excellencies, and just that said, I'd like to thank the organizers of the Pacific Satellite Summit, Pacific Disability Forum, the Pacific Uninformed Secretary, the Government of New Zealand and the Government of Australia for inviting ION to speak on this topic. So my short intervention is really just to focus on disability inclusion in the context of climate change, related migration, displacement, and planned relocation in the Pacific commitments for action. So I think the previous speakers before me have described, of course, that disasters such as cyclones, floods, and drought disproportionately affect globally 15% of the world's population includes people with disability, but this number is expected to be a lot higher in areas exposed to disasters and climate change. And at the same time, we've also heard that people with disability experience or may experience multiple forms of discrimination, as well as heightened risk of violence and abuse, particularly in humanitarian context. So in order to really understand the experiences of people with disability in the context of climate change and human mobility, in the Pacific region, the Pacific Resilience Partnership Technical Working Group on Human Mobility that IOM chairs undertook a research on this topic. And essentially what we tried to do was focusing on Vanuatu, Solomon Islands, and Fiji. The study aimed to unpack the experiences of people with disability, the level of disability inclusion, particularly looking at national level policies of displacement, planned relocation, and some recommendations to strengthen responses. So looking at the case study from Vanuatu, what we saw was that people people with disability due to lower access or limited opportunities to access education were increasingly employed either in the informal sector or engaged in agriculture for subsistence and livelihood. And what this also showed is that they were expected to provide a lot of support services to family members through engaging in fishing, gardening, and pig rearing. And what this ultimately created was increased exposure to climate change related shocks. And while many other family members could seek migration to urban areas as an opportunity to offset any income losses or losses in livelihoods, this was not an option for people with disability. We've also conducted regional consultations, national consultations in order to understand of climate change on mobility and to basically look at how people have been affected by this issue, including people with disabilities. And one of the things that we have heard is that while in atoll countries, there is this opportunity of overseas migration and labor migration, including seasonal worker schemes, as a way, again, to offset livelihood losses. Because of barriers and requirements placed in the selection process, this was something that was not effectively possible by people with disability. Now, looking at the national level policies, what we've seen is that national level policies, including the Vanuatu displacement policy, as well as the planned relocation guidelines in C3, these do, within the policy itself, consider gender equity as well as the needs, special needs of people, including people with disability, but the actual awareness of people with disability as well as other marginalized groups are not perhaps fully aware of these policies, and neither are they fully integrated into implementation. So this is just a very initial research in terms of the coverage of or the initial examination of the experiences of people. But what is clear is that there needs to be increased documentation and data on this issue across the region. And just to share what is working on in terms of our work across the region, in Micronesia, IOM has actually been looking at
Callie, I believe you're frozen. Perhaps disconnected.
apologies, colleagues, for dropping out there, but essentially just to finish on that point and to say that part of our work has included having people, households that include people with disabilities, well, evacuation center work that we're leading in Vanuatu, looking at developing SOPs for addressing gender-based violence in the context of evacuation. And this work actually incorporates the intersectional understanding of risks, including how people with disability may be particularly at risk of gender-based violence. And so as part of this process, including on developing national evacuation center management guidelines, we have also engaged with local disability organizations and ensured that they are involved in the process right from the outset as I think has been highlighted as an important practice by several of our speakers. The final example is just work that we're leading under the program that I manage on Pacific climate change, migration, human security, which aims to support a regional framework that will guide action to address climate-related mobility. And just to note that as a standing, the principle of the program is that to ensure that a regional framework is shaped by the experiences of all members of our communities, we have, of course, a standing invite to all national NGOs focusing on people with disability as part of these national level consultations. So as a bottom line, perhaps just to echo that across all of our work, we prioritize and systematically factor in disability inclusion. And through the discussions today, I take note of the point before about evacuation centers for all. And just to say that this is something that we'll continue to engage on this topic. And we look forward to working with organizations and champions of disability inclusion. Thank you.
Thank you, Sabira. And my sincere apologies for the technical glitches, particularly for those who have been joining us online, and also for those who are here with us in Suva. I hope you can hear me now. We've just kind of switched, me and Sabira.
Yes,
Yeah,
we
we're
can hear you
hearing-
clearly.
We're hearing
Thank
you
you
from
very
Solomon
much.
Islands.
Thank you very much, and thank you also for the initial state of play by His Excellency, but also the perspectives from Reverend James Bhagwan. I think we've highlighted areas that could, for more improvement in terms of how we include peoples with disability. Also, thank you, Caspar, for sharing some of what has been happening at the national level and what Solomon Islands is doing. And also Sabira for sharing with us what IOM has been doing as a partner in this area, and particularly the areas of work that is happening. I will now open up the floor for questions and request Ellie, if you have any questions through the chat box that we can share.
Yes, so please put your questions in the chat box and we will direct them.
Maybe while we're waiting for the questions, while everyone is formulating their questions, but also I understand the people at the here in Suva, if you can also raise your hands and someone with a microphone will share microphone with you for any questions. But maybe as a start, I'd like to pose a question to the panelists. It has been 4 years since the last Global Disability Summit in 2018. And noting the current issues with COVID-19, tropical cyclones impacting the region and other climatic events, I think Reverend James, you mentioned around relocation. What do you think has been a game changer in terms of disability inclusion and the rights of persons with disability? And where would you want to see more improvements? Maybe I hand over to you, Reverend James first, and also Your Excellency, happy for you also to jump in, but maybe Reverend James, and then Caspar, and then Sabira, and then Your Excellency, if you would like to add some points. Reverend James, over to you.
Thank you, Tia, for the question. I think really in the work of the Pacific Conference of Churches, our focus to be more intentional about disability inclusivity and more direct partnership or engagement through our relationship with the Pacific Disability Forum has been the main thing for us. It is being disability inclusive in our work is now part of the PCC strategic plan. And not just generally inclusive, but having specific reference to ensuring that the church amplifies the voice of communities with people with disabilities. So we recognize the role of the Pacific Disability Forum within the church, the global ecumenical movement. We have the Ecumenical Disability Advocacy Network, EDAN, which we have been working with the Pacific Disability Forum to revive and get quite engaged here in the Pacific. We're currently undertaking a survey in partnership with the Pacific Disability Forum to our member churches on the issues around access, engagement, pastoral care, and empowerment for people with disabilities. So it's still very early days, which is not good. But one thing I have noted is that we have these things entrenched in our communities. Particularly, we saw, from the Christian care and compassion perspective, the indigenous responses of caring for community, and that we have within our region our own understanding of leaving no one behind. In Fiji, we call it Sole Solevaki, that sense of community and that sense of recognizing that, it is, disability does not mean inability. And so this is where we are working in, and we recognize that there are many other partners. So we do not want to compete. It's about complementing and collaborating wherever possible, and particularly from our perspective, ensuring that the voice of people with disabilities is heard within the church space. If we can get that going, if we can shift some of the stigma, as we've heard in one of the comments after my presentation, particularly around mental health issues, those are some of the key things we would like to focus on. Minaka.
Thank you, Reverend James. And I think, yeah, you picked up on some of the chats that are coming through, particularly around the stigma, but also I think from the previous panel discussion around the value, inclusion of all is value for all. I think, Caspar, over to you.
Thank you. Yes, we have seen a shift from charity now to empowerment in Solomon Islands. Advocacy has been the main core of business for persons with disabilities, but I think there is now an opportunity, given the fact that there are now growing partnership between the DPO organizations at the national level with the INGOs, who has the credibility in terms of working and aligning with the international agencies as well. And that brings the kind of working relationship that has shifted the charity mentality to now bringing more partnership with people with disabilities, in this case, for us. The other opportunity, given the slowness of government commitment, we feel that it's now time, with the support of the international agencies, we would be able to now create service, not just an advocacy organization, but perhaps there is already now an opportunity to become a service provider as well. So all we are saying is the area of advocacy, giving information for Solomon Islands would be now enough, than transforming those information into practical demonstrations and supporting the reality and the needs of persons with disabilities, which is more important to many of the programs that we are currently trying to do. I'm happy to say here that we now have engaged the International Women's Development Agency at the moment to see climate change in the perspective of gender as well, and that we will be certainly engaging some of the programs in the 3 years to come, given the opportunity of a new program that we have solicited with the European Union. So that is something of a hope that we will create, not only in terms of advocacy, but certainly will move a little bit forward to creating opportunities in providing some of the services that are expected from the state. Thank you so much.
Thank you as well, Casper, for that. I think you do highlight a good point in regards to partnership, and I think it was mentioned by Reverend James as well. And you do highlight a point around shifting away from the sort of charity mentality. I now hand over to Sabira for some insights from a partnership perspective. Thank you.
Thank you very much, Tia. So perhaps just to respond directly to the question in terms of the first one on the game changer for disability inclusion. IOM being a UN agency and working as part of the Interagency Standing Committee, I think for us, what has really been a game changer is the IASC's guidelines on disability inclusion in humanitarian action. And this has really laid out, I think, essential actions that all humanitarian agencies, including IOM, need to take to ensure that minimum level of disability inclusion. So this is, of course, I think, been extremely useful in terms of ensuring that disability and people with disability is systematically included. But of course, there remains a lot of work, perhaps unfortunately, in order to ensure that we move from simply including in strategies and guidelines to having that actual change being seen on the ground. In terms of the work we're seeing here in the region that perhaps needs, it also I think relates to the point that I made before, we need to make sure that all of our work is based on solid data and evidence. And one of the points that one of the areas of work that we're looking into is ensuring that we have systematic data following a disaster situation on displacement. And within that context, having that disaggregated, including looking at the needs of people with disability. So this is something that I think is a sort of a work in progress, but will probably need a lot more emphasis to ensure that there's that solid basis of data and evidence. And then, of course, this can also help inform improved evacuation processes that I think have been highlighted, and then eventually looking from there onwards from response to recovery efforts. So I'll probably stop there, and thank you, Tia.
Thank you, Sabira, for that. I think you've highlighted some good points in regards to evidence-based data, but also the follow-up after an event, which I think should be continuous action and improvement in that. We are close to our time, so at this point in time, I'd like to give it to our rapporteur online to share with us some of the key asks, and then we'll close the session after that. So I'll hand over to a rapporteur. Apologies for that again. Ellie, can you advise if our rapporteur is able to join us or?
Yes, sorry, just checking now. So what is the name that I should be looking for?
Sabia, from CBM.
Hi everyone, it's Liz Morgan from CBM Australia speaking here. Sorry, apologies. Yeah, there has been a couple of us doing some rapporteuring for this breakout session. Someone in the room there in Suva, but myself online. So I'll jump in. It's been a really great conversation. It's been great to hear from a range of partners, a bilateral donor, a UN organization, the church and religious groups, and a national organisation of people with disabilities themselves. So we've been really lucky to have a range of experiences to draw from in our discussion. Some of the key things that we've talked about have been the experiences of people with disabilities facing significant barriers before, during, and after disasters, including climate change impacts and the COVID pandemic. We've touched on the importance of considering displacement, which in some cases is a rapid, need to get to an evacuations centre to be safe, and other cases with sea level rise is an ongoing, move for communities to be safe into the future. We need to be ensuring that people with disabilities are being seen as people who have important expertise and experience to bring to these conversations. So thank you to everyone who's been bringing out ideas of what that can look like. It's great to hear of some of the research, data collection surveys that all of our panelists mentioned to try and fill this gap even more, to be bringing the real life experiences of people with disabilities to the decision-making table. Thank you, Tia, and apologies, I wasn't quite on the ball to get straight to my microphone.
That's all right, Liz, and thank you as well. And thank you again to our esteemed speakers and panelists. Apologies again to all those who joined us in regards to technical issues we were facing. I hope you did get some key messages out of this session. I will be reporting back at the panel session, but unfortunately, time is not on our side at this point in time. So again, a very big thank you, and I hope you all have a good afternoon. Thank you, everyone.